Welcome to the Neuroguard device preparation and deployment instruction video. The Neuroguard IEP 3-in-1 carotid stent and post-dilation balloon system with integrated embolic protection is a combination of self-expanding carotid artery stent, a nitinol embolic protection filter, and a post-dilation balloon. The system is rapid exchange and is compatible with commercially available primary distal embolic protection devices with an 0.14 diameter guide wire. It consists of a multi-lumen shaft with an inflatable semi-compliant angioplasty balloon at the distal end and handle of the proximal end. Distal to the angioplasty balloon is an integrated filter in the baseline collapsed state. A nitinol self-expanding stent is preloaded on top of the angioplasty balloon. Both the stent and filter are covered by an outer sheath. The system includes multiple radiopaque marker bands. Before we begin the device preparation, I'd like to introduce you to two quick reference guides that are available to assist you. First, the Neuroguard IEP preparation guide, which walks you through the necessary preparation steps here. And second, the Neuroguard IEP procedure guide, which provides a step-by-step walkthrough of the deployment process. These guides will be valuable resources through the process. Before we start the device preparation, let's review the recommended materials that are not supplied, but you will need. An 0.14 primary distal filter-based embolic protection device, a 6-French sheath, minimum, or an 8-French guide, your standard hemostatic valve or Tui-Borst adapter, an inflation device, your balloon inflation solution, 20% contrast, 80% sterile saline. The Neuroguard IEP system should always be used with a primary distal embolic filter. The device was studied with the Spider FX filters, the Embo Shield, NAV6, the FilterWire EZ. The safety and effectiveness has not been evaluated with any other embolic protection system. What is included? The Neuroguard IEP system, preparation syringe with filter flushing tip, which will be flushing syringe A, preparation syringe with catheter flushing tip, flushing syringe B. Sheath retraction and stent deployment thumb wheel, filter deployment knob, distal and proximal balloon markers, nitinol closed cell stent, 6 filter marker bands and distal filter marker band, 5mm tip length, 40 micron pore membrane, and an 18mm filter length. For sterile devices, you will peel open the pouch and remove the enclosed tray containing the Neuroguard IEP system. Please inspect for any potential damage to the sterile barrier. If it is suspected that a sterile barrier seal has been opened or compromised, do not use the Neuroguard IEP system. Please return it to the manufacturer. Please note, the instructions are printed on the tray lid. Keep this for a reference. Remove the filter protective cover and the metal stylet and discard. Carefully remove the device from the hoop in the tray. Syringe A is a preparation syringe with a filter flushing tip. It is used to flush the filter membrane. Syringe B is a preparation syringe with a catheter flushing tip. It is used to flush the catheter. With our syringes already filled, syringe A and syringe B are both filled with sterile saline already. We're going to take our saline basin and we're going to fully submerge the distal end of our device, making sure that the filter in its entirety is submerged in saline. With the distal end fully submerged in saline basin, you partially open the filter by rotating the filter deployment knob on the handle counterclockwise. Fill the enclosed flushing syringe A with saline, which we've already done. Remove all the air bubbles with the flushing syringe A. We're going to flush the filter until no air bubbles are seen. Close the filter by rotating the filter deployment knob clockwise while gently massaging the filter membrane to ensure there is no entrapped air within it. While keeping the distal end submerged in saline, hold the catheter tubing of the blue outer sheath and using a slow, steady pressure, gently advance the outer blue sheath over the filter until the end of the outer blue sheath contacts the soft distal tip while holding the catheter proximal to the outer sheath. Make sure not to cover the yellow nose cone. Always make sure that the sheath is moving towards the yellow tip. Moving the outer sheath in the opposite direction can result in inadvertent release of the stent. Using syringe B, we're going to flush the distal tip of the catheter until we see saline exiting the proximal end of the outer sheath. Next, we will prepare the balloon. Attach a stopcock to the balloon inflation port of the catheter. Prepare an inflation device according to the manufacturer's instructions. Purge the air from the catheter using the inflation device syringe filled with 5 ml of the balloon inflation solution. Hold the syringe with the nozzle pointing downward and aspirate the lumen for 5 to 10 seconds. Repeat until no bubbles are seen during aspiration. That's it for the prep. It's pretty straightforward. Please note, keep an eye on the Neuroguard IEP preparation to ensure no one accidentally deploys the stent on the table. Remember, our outer blue sheath only needs to move distally at this stage. The Neuroguard IEP system can be used with a sheath or a guide catheter. The internal diameter of the sheath introducer or guide cath should be at least 0.084 or greater in diameter. The device was studied with FilterBar EZ, EmboShield Nav6, and Spider FX filters. The safety and effectiveness have not been evaluated with other embolic protection systems. Ensure that the primary distal embolic protection device is in place prior to introduction of the Neuroguard IEP system or predilation of the target lesion. Ensure an adequate landing zone in the cervical carotid artery to allow the deployment of the primary distal EPD and the Neuroguard IEP system, keeping in mind that the Neuroguard tip extends beyond the distal end of the stent. Please note, as a reminder, there's a 3.6 centimeter runway from tip to distal edge of the stent, and there should be at least 1 centimeter between the distal marker on the Neuroguard IEP system and the proximal end of the primary distal EPD. Under fluoroscopic guidance, advance the Neuroguard IEP system over the 014 guide wire until the lesion is visualized between the distal and proximal markers. Ensure the Neuroguard IEP system within the carotid artery is such that the filter is located immediately beyond the lesion and the stent is over the lesion. Before deploying the filter, confirm that the desired stent location and make any final adjustments to stent positioning within the artery. Remove the locking pin, which prevents premature turning of the stent deployment thumb wheel from the handle and discard. Slowly retract the outer sheath by rotating the thumb wheel towards the proximal end of the handle. As the outer sheath retracts, audible clicking will be heard. In addition, a radiopaque marker on the distal end of the outer sheath will be visual during retraction of the outer sheath. Retract the outer sheath until the radiopaque marker at the distal end of the outer sheath is positioned below the bottom of the filter and above the stent. We would see this superimposed with the proximal end of the filter and the distal end of the stent. The filter will be fully exposed at this point and can be deployed. At this point, we're going to pause because remember, this is a self-expanding stent. If we continue retracting the outer sheath without stopping and carefully visualizing everything under fluoroscopy, we risk unintentionally deploying or flowering the stent too soon. Even though we've aligned our balloon markers and positioned the stent within the lesion where we plan to deploy, it's always best practice to take a moment and reconfirm our exact positioning before proceeding. Deploy the filter by slowly turning the filter knob deployment counterclockwise or to the left. There is no tactile feel to the filter deployment against the vessel wall. You will have to watch the 6 marker bands separate under fluoro. Verify that the filter is fully expanded and opposed to the vessel wall by visually confirming under fluoroscopy. Please caution, do not force the knob if it is not turning freely. Take care not to oversize the filter to minimize vessel trauma. Connect the balloon inflation device to the stopcock on the end of the balloon port of the catheter and check to see that the connection is secure. This will reduce possible introduction of air into the system. The Neuroguard stent is deployed by retracting the outer sheath using the rotating thumb wheel towards the proximal end of the handle. The marker on the distal end of the outer sheath should be fluoroscopically monitored during outer sheath retraction. Stop retraction via the thumb wheel when the marker on the distal end of the outer sheath reaches the proximal end of the stent. Following stent deployment, angiographically confirm that the distal and proximal balloon markers are still properly positioned within the stent and across the target lesion. After the stent has been completely deployed, angiographically verify placement within the artery. Prior to post-dilation, ensure the pre-positioned balloon is within the stent. Using an inflation device, inflate the pre-positioned post-dilation balloon to the desired size, using the compliance chart in Table 14 as a guide. The inflated nominal diameter of the post-dilation balloon should be approximately the same as the diameter of the reference native vessel. Deflate the balloon after the desired size has been reached. At nominal pressure, 8 atmospheres, the balloon diameter will be 5 millimeters. Collapse the filter by turning the filter deployment knob clockwise. Continue turning until the handle stops turning. Angiographically confirm that the filter has collapsed using the circumferential filter markers. Withdraw the catheter slowly while preserving guide wire position. Please note, a radiopaque marker is located 1 to 2 millimeters proximal to the catheter tip and can be visualized fluoroscopically during advancement and retraction through the lumen of the deployed stent. The guide wire should remain across the lesion until an accepted result is obtained and verified angiographically. As the filter passes through the deployed stent, withdraw slowly and under angiographic guidance. Ensure that there is no resistance when withdrawing the filter through the stent. If resistance is felt, gently advance the catheter under angiographic guidance, rotate, and then withdraw again. Remove the catheter slowly through the guide or sheath under angiographic guidance. Ensure that hemostasis valve and Tuohy-Borst adapter are fully open when removing the device. Upon final angiography confirming a satisfactory result, the primary distal filter-based embolic protection device should be removed along with the sheath or guiding catheter. Refer to the manufacturer's instructions for use when removing the distal filter-based embolic protection. Hemostasis of the puncture site should be established.